I'm Jennifer Duvall, CEO of the Pasadena Community Foundation.
Community foundations are designed to meet the changing needs of the communities they serve. COVID radically changed these needs almost overnight. And PCF immediately turned our attention to relief efforts focusing on food insecurity, distance learning, and telehealth. When the vaccines became available in 2021, we understood that the fastest way to get everybody back in school and back to work was to focus on the vaccine rollout and vaccine equity. Initially, there was still limited supply of the vaccine and only seniors were eligible. The director of Pasadena's Public Health Department, Ying Go, reached out to us to discuss strategies for getting the vaccine to hesitant and hard-to-reach populations.
The Pasadena Public Health Department has been delivering vaccines since the very beginning with a very limited vaccine supply and very, very high demand. Of course, our priority is always access and equity. Our goal was for other individuals in our community who are still unvaccinated to be able to find vaccine in their neighborhoods in a location that felt comfortable and safe, and with members of our community there, our community partners who they trusted, and then convenience. Those are the goals of our mobile clinics.
I think there are many barriers to the implementation of equitable access to vaccine. I think misinformation existed in our communities, lack of information, lack of access, and understanding how to navigate the system, and then how the vaccines were deployed. And what I realized is that we are going to need trusted allies, trusted individuals from our community that people know, people trust, faces are familiar, for us to help folks feel a sense of immediacy and also a sense of that, I can trust the system and how I can access it.
So when we did our first vaccine clinic with the NAACP, that was on February 13th, it was a challenge because that was still very early in the vaccination period and everyone was trying to get vaccines. So we couldn't open it up to the public because as soon as we opened up a clinic, it would fill up just like that. So what we had to do is we had to make it a closed clinic and we had to register each person by hand. So it was a huge effort, but we were excited that we were able to vaccinate over 100 people that first day. And after that, we scheduled 11 more pop-up vaccine clinics. Several of the sites that we did after that were we did 2 more sites at NAACP, so for a total of 3. And we also went to Harambe Ministries and we did 100 vaccines there.
The Pasadena Community Foundation really helped to facilitate our goals for the vaccine clinic because you really made it possible for us to be highly responsive to the public health needs of our community so that we have an eye towards health equity and eliminating the health disparities. Ultimately, in the initial 16-week vaccine clinic effort at Pasadena alone, from February through May, we did 1,288 COVID vaccine visits with an all-time total of 1,389 COVID vaccine clinics.
Thanks to the Pasadena Community Foundation, because we were able to expand our reach. I mean, the reality is to put on those clinics wasn't an easy thing to do, right? The staffing, the resources, the location. Thanks to the Pasadena Community Foundation, we were able to do more clinics than we initially had anticipated being able to facilitate.
One of my favorite stories was about a man who was passing by when we were at the NAACP and he inquired, what's going on here? And when he found out, he went home and he got his neighbor, who was a 96-year-old African-American lady, and he brought her to get his vaccine. And it turned out that she was the widow of a former NAACP president.
We're very grateful for the Pasadena Community Foundation's support, but also the many partners that make up our public health system in our city, including Huntington Hospital, for example, healthcare providers, and also Planned Parenthood, and different community health providers who have access to and are trusted by different segments of our city. And by having a diversity of groups that are funded to do this work, that really reaches a greater proportion of our community members. We're so grateful to every Pasadena community member for choosing vaccine, which has enabled us to get to an 86% fully vaccinated rate for people who are 12 and older.
Over the past year and a half, PCF has become a much more collaborative organization. We truly believe that our impact has been greater through these partnerships. We were at the table with many others, all doing their part. But I know that our organization will be forever changed for the better.